When we tried to explain to him, you just died, and we were able to bring you back, it might not happen next time.
Yesterday, News 4 Investigates took you to the front lines in the battle against the heroin epidemic here in Western New York. Tonight, we're learning more about what's being done to help the addicts get the treatment they need.
As News 4 Investigates and Luke Moretti reports, there are plans to change the system.
I have 22-year-old female, breathing unconscious.
There's some frustration on the front lines of the heroin and prescription drug epidemic.
It's a drain on the hospital system. It's a drain on our system.
First responders who say there's got to be a better way to deal with the addiction crisis.
We need to do something to make treatment centers readily available and make it easier.
They're responding to overdoses and reviving people with Narcan.
Can you hear me, Bob?
But the drug cycle continues to worsen.
We're averaging about 10 to 11 suspected overdose-related deaths per week. So it's really a crisis situation.
Erie County Health Commissioner Dr. Gail Burstein agrees that the crisis is stressing the healthcare and mental health care systems. She says a 24/7 telephone hotline will soon be online to match the need for treatment with what's available out there.
So now we have a new opportunity that people don't have to try to figure out the system by themselves. It's really open to anybody to, help somebody who is addicted and really wants to get into that care.
Gregory Gill, Deputy Commissioner of Erie County Emergency Medical Services, says he hopes the spike in overdoses is not because people feel they'll be revived with Narcan.
We had a gentleman call up once that wanted the ambulance to stand by for him. Didn't want him to come yet, but wanted to make sure the ambulance was standing by with Narcan. They did stand by for him and eventually went to get him.
But Erie County Mental Health Commissioner Michael Ranney doesn't believe addicts are pushing the limits because of Narcan.
Narcan saves lives, and sometimes it may take more than one or two occurrences before somebody may make a decision to get into treatment.
This is a disease of the brain. People do not have a choice about using or not using who are addicted. They really don't have a choice.
Well, the Crisis Services Hotline, once it's up and running, will be available for anyone who's looking to connect those in need with treatment. Dr. Burstein says the hotline will be staffed with substance abuse experts who can conduct an assessment and then coordinate what needs to be done from there. Luke Moretti, News 4.